I'd told you earlier on nutrition in the country, and I will be speaking to Leah Kagwara, the country director for Global Alliance for Improved Nutrition in Kenya. And also joining us is Professor Daniel Silla from the Jomo Kenyatta University of Agriculture and Technology, JKU at. Ladies and gentlemen, and thank you so much for joining us on News Center.
Pleasure.
Great. Now, we begin with these, appalling numbers that are just about 1.82 million children, rather 26% in Kenya, are suffering from chronic malnutrition. Madam Leah Kagwara, how appalling is this? How dangerous is this? Because, I mean, children, being a child is where you form pretty much your basic nutrition cycle, but such a huge number is at risk.
Thank you very much for that question. It is indeed a pleasure to come and talk about this subject here. It is really appalling. Actually, by percentage, we are talking about 26% of all children under 5, which is the indicator that we use to measure the population status, are being stunted. So that means those children, or that percentage of people growing up in Kenya at any given time, are not attaining their full developmental potential. It means they don't grow to normality, to the normal human being that would be able to take advantage of their full potential in life. So it is really a critical issue. And once it happens at this stage of life, when you are especially under 5, it means it cannot be changed after that. So you grow up to be an adult who cannot actually reach your full potential. So that is how serious it is.
Mm-hmm. Professor Daniel, there is, you are from academia, and there is just so much, with nutrition-related issues in Kenya. What are some of the causes, and what are some of the steps that are being taken to just improve nutrition? But let's begin with the causes first of malnutrition in the country.
Thank you very much, and I appreciate a lot being here today. Mm-hmm. I think the main underlying causes for this are poor diets. Diets in Kenya are really basically very starchy with very poor proteins integrated in the food system. Mm-hmm. This is what results largely to what we call protein energy malnutrition. Mm-hmm. But also, where we eat a lot of ugali, we remove the outer bran of maize flour, which actually holds the key micronutrients. So we end up eating food which is depleted of micronutrients, which are of health benefits. So this also consequently leads to poor nutrition. We eat also a lot of foods which are low in fruits and vegetables, and the fruits and vegetables are the main health nutritious food products that contains fibers, vitamins, and other micronutrients of health benefits. This is poor. Our eating habits and culture really leads to poor diets. We also have a lot of manifestation of diseases which deplete nutrients within the body. Other causes would be alcohol-related and other underlying causes. So largely nutrition, disease, the main whatever, and poverty is a key driver. Mm-hmm. The government is doing a lot, and I think through the Ministry of Health, the Ministry of Agriculture, the Ministry of Trade, there are interventions which are targeted to increasing access to nutritious and safe food to all Kenyans, mm-hmm. and the Constitution of Kenya provides for this. Mm-hmm.
Yeah. Right. Leah, talking about the government and the intervention from the government, we do know that in 2012, the Kenya government committed 6 billion shillings to scaling up nutrition. How far of implementation of these funds, and are there any successes so far? Because 2012, we're now in 2021, that's just about 9 years. The 5 years lapsed because that was during the tenure of Health Minister Beth Mogo back then. Were there any fruits or gains from that fund?
I can say that there has been a lot of gains within that period. First of all, we have seen the government institute a food security policy. The government has gone ahead through the Ministry of Health, through the Ministry of Agriculture, to actually develop implementation frameworks for those two. So there is an agri-nutrition strategy, there is a food and nutrition security implementation framework, and lately the Ministry of Health has also instituted the Kenya National Nutrition Action Plan. So a lot has been happening. But let me come back to one more important thing that has happened since 2012. Mm-hmm. Around 2012 to 2014, the government actually worked so hard to mandate food fortification for the main are food drivers that we consume, the maize flour, the wheat flour, the oils that we use, and the iodization of salt. So we can say that the government has actually tried to work really hard to ensure that we are improving consumption of safe and nutritious food through various policies and implementation frameworks. I think there is still a lot more to be done. And just to go back to the question that you just asked, because what Kenyans are really suffering from is what we now call a triple burden of malnutrition. So that is micronutrient deficiencies because of failure to eat a diversified diet, and also to eat the already available fortified foods. The case for other nutrition, which you just talked about earlier, that is stunting when you're still very young, and then the case for obesity. So increasingly, we are seeing more Kenyans being obese. They could be eating enough calories, but they are not taking enough micronutrients, and so they're just filling their tummies, as Professor has just said, with starchy food and no micronutrients. So these are the things that the government is trying actually hard with development partners to work around.
Okay, right. And Leah, I'll come to you, back to you on matters obesity and malnutrition. But Prof, I'm curious to know, what is the role of academia? Because we are rather in fighting malnutrition and improving nutrition in the country, because we've seen instances where there is just so much material to read out there, but actualizing or putting this into practice is not as easy as it may seem.
Thank you very much. I think the role of academia is to increasingly provide evidence that can be used to provide action. I think we, as a university, should use science, technology, and innovation to provide scientific evidence in the various facets of action, and based on data, which is based on the current demographics and also based on the geographical locations. We can provide actually targeted interventions which are based on the local situation. Northeastern Kenya, for example, is quite different from the coastal belt, from Nairobi, and the levels of malnutrition are different. That's why counties using research produced from the specific areas should be able to address this, but using evidence which is based on current trends and the current situation. So we create a knowledge economy which should advise policy, which should advise strategy, which should advise future direction. We provide innovations which could circumvent some of the areas, and also technologies for quickly moving forward. I think everybody now knows the power of ICT, the power of use of mobile technology, and I think these are some of the interventions. Creating awareness, I think, is an institutional role for universities. So if we want to change, if we want to move, we have to really get into a knowledge economy, investing in capacity to deliver in all the areas of food and nutrition security. And this is what will drive change.
Right, Leah, when you think about the different demographics from the young and old, and going back to the issue of malnutrition and obesity, there are those within, first of all, what is the percentage in both the young and old? In the young generation, what's the largest percentage? Is it the malnutrition or is it the obese? And in the older demographics, is it the malnutrition or the obese who make up the largest percentage?
Yeah, so in the young generation, it is the undernutritioned children that make up the larger percentage, which is 26%. About 10 or so % of children now have been found to be obese already. In the older generation, it is, women are the biggest indicator. So I know people could still do research around men, but the indicator is around women. I can't recall the percentage right now, but there's quite a big percentage of women now that are obese. That is an indicator of the general population. But besides obesity and stunting, which is at 26%, there are other micronutrient deficiencies that are also being found. That is iron, lack of iron, zinc, especially in women of reproductive age, pregnant women. And probably we'll come back to that later, but we have to know that when women of reproductive age or pregnant women are not taking enough micronutrients, it obviously affects the children that are going to be born.
Right.
Yeah.
And, sticking with that matter, or rather that issue of obesity, now, those young people, as they grow older, you realize that some have, fallen either into the category, most of all, as you've mentioned, of obesity because of the poor background, or rather the poor foundation that they had on matters nutrition. So how then do you combat, because children, we all know, as you've said, mothers and women, growing up, a child in Kenya is believed to be healthy if they are plump, if they are big, if they've eaten to their fill. Yeah. And, some communities say they have eaten with both their cheeks and they are full, and they have even formed some curves. But how then do you ensure that as a child, once you reach a certain age and you're able to understand, you're able to, perhaps be able to mitigate that and ensure you lead a healthy life?
In fact, let's go back before you even reach the point of making the decision yourself. And so let me just clarify here that the adolescent girls, that's where it begins. They need to be in a good nutrition status. So when it comes to consuming a diversified diet, a diet that is high in the essential micronutrients, the ions, the zinc, etc., that begins at adolescent. Because this girl is preparing to become pregnant at some point when she's, of course, when she gets ready, not when she's an adolescent. When the woman is expecting, there should be ultimate care for that woman to ensure she's consuming the necessary micronutrients. I know there are still some communities that are saying a woman cannot consume this and cannot consume that when they are pregnant because the baby is going to be so big, etc. Those are actually false myths. That woman is supposed to be eating the healthiest in that household. Right. Now, when the child is born, exclusive breastfeeding is the foundation. 6 months of exclusive breastfeeding. Many Kenyans have heard about this, but they probably don't know why. So that is when the child's body formation, brain formation especially, is being formed. Once it is not properly formed in the first 1,000 days, because of undernutrition, lack of that exclusive breastfeeding, and after 6 months, very well guided complementary feeding, this is what it is called. That is giving the child food that has got the essential micronutrients until they are 1,000 days. The brain is not formed well, and that is what we call stunting. Or, they call it low height for age, but really it's not just the physical body, it's even the internal body. So if the brain doesn't grow at that stage, that person already becomes damaged. Now, when it reaches...
I have to cut you short because I'm told time is also running out, but I'd like to bring in now Prof, because the Agri-Nutrition Strategy 2020 to 2024 has so much, coming up, and there is the second Kenya Food Fortification Summit, which is coming up between June 29th to 30th. Prof, I wonder, what are some of your expectations, especially coming from the academia field, for this conference?
Thank you very much. I must say, yes, there has been significant strides made towards ensuring that Kenyans have become healthier by eating safe, nutritious food products. So for the Food Fortification Summit, I think we want to be able to take stock of what has been happening over the previous years. It's already 2 years since we last met, and I want to thank GAIN for being co-host into this. So within the last 2 years, I think we have done a lot of awareness. We worked with private sector, with different government ministries, development partners, in trying to strengthen food fortification within the country. So this is a moment now to reevaluate and see what has been done, take action, and try to see what direction we need to be able to move to ensure that there is action which is informed by our previous knowledge.
Prof, I want to give you now 5 seconds to 10 seconds. Just briefly, your closing remarks, and also Leah, your closing remarks even as you end up this interview. Beginning with you, Prof.
Thank you very much. I think for the Food Fortification Summit, I think we need to be able to think how best, as a coalition of multisectoral elements, on how we can strengthen food fortification. We need to know where we have not performed, so that we can now relook at ourselves and see what interventions will bring the best results. Yeah.
Right. Leah, your closing remarks?
We are really looking forward to this summit to take stock of the gains that have been made, but most importantly to see where do we need to place action. Who needs to ensure that there is compliance in fortifying foods appropriately as should be expected. But the most important thing also is for the population. What action do we need to take to make sure that the population is aware of what are fortified foods, what should they be eating, but beyond the fortified foods, which is addition of micronutrients, as I said earlier, how about consuming better diets, diversified diets that contain those micronutrients? So we are looking forward to seeing what opportunities can we take to drive these actions.
Thank you very much. Unfortunately, I'm told we are pressed for time and we have to wind up. Thank you so much for joining us. I have been speaking to Leah Kagwera, who is the Country Director for Global Alliance for Improved Nutrition Kenya, that is GAIN. Also in studio was Professor Daniel Sila, who is from the Jomo Kenyatta University of Agriculture and Technology, JKUAT. My name is George Maringa. We appreciate your tremendous feedback. I will be back at at noon, that is at 12, with a special broadcast on this day, with NACADA, as the Kenya and the rest of the world continues to mark this day against trafficking, the World Drug Day, and also against illegal trafficking, or illicit trafficking of drugs. That conversation is coming up next at noon. That is in the next perhaps half an hour. I'll see you then. My name is George Maringa. Do stay with KTN News.